Assalamu alaikum, I am Dr. Suhaib. We all have been familiar with the fact that smoking is injurious to health. So, now let's begin our topic. So, basically, what is smoking? Smoking is defined as inhalation of smoke from tobacco and from other substances. Now, moving towards the epidemiology of the smoking, according to the World Health Organization, 22.3% of the whole world population is smoking, out of which 36.7% are the men and 7.8% are the females. Now moving towards the types of the smoking, there are two types of the smoking. The first type is known as the active smoking. The second type is the passive smoking. In active smoking, the person is smoking cigarette himself. In passive smoking, the person is inhaling the smoke from someone else's cigarette. Now moving towards the causes of the smoking, there are four causes of the smoking. The first is the psychological factors like stress, tension, etc. The second is the social influence like social norms. The third is the genetic predisposition. The fourth and the most important cause of the smoking is the curiosity and the experimentation among the young generation. Now moving towards the mechanism of the smoking, that how a person becomes or addicted to the smoking. Nicotine, which is a component in the smoke, it transfers into the bloodstream, and from the bloodstream it goes to the brain, and it activates the neurotransmitter like dopamine, which gives a feeling of pleasure or reward. Now moving towards the adverse effect of the smoking. The first adverse effect on the cardiovascular system is that it causes atherosclerosis and it causes the ischemia and hypoxia. On the respiratory system, it causes the COPD, which is a chronic obstructive pulmonary disease, and emphysema and asthma and chronic bronchitis. Smoking also causes cancers like lung cancer, throat cancer, bladder cancer, prostate cancer. And on reproductive health, smoking decreases the fertility in both males and females. And smoking also causes the complications in pregnancy like low birth weight and preterm birth. Now moving towards the advantages of the smoking. Smoking causes alertness, and that's why we have seen that truck drivers use smoking at night so that they can drive their truck properly without feeling asleep. The second advantage is the stress relief. The third advantage is the weight loss. There are some diseases in which smoking is beneficial and the doctor didn't advise to quit smoking. The first disease is the Parkinson's disease. The second disease is the Alzheimer's disease. The third disease is the ulcerative colitis, and the fourth and the last one disease is the primary sclerosing cholangitis. Now heading towards the prevention and cure of the smoking. It includes the rehabilitation centers and the social awareness. Now moving towards the conclusion, smoking has advantages as well as disadvantages, but its disadvantages take over its advantages. So I, as a medical professional, suggest all people to quit smoking and make their lives better. Thanks a lot.